So do you have a lot of fat in your abdomen and the sides? So you're going to gym, you are dieting, but you're not getting rid of this fat. We are routinely doing liposuction to remove the fat. So have you heard about the liposuction or the tummy tuck? So these are the cosmetic surgery or the plastic surgery procedures. So I am a plastic surgeon. So we are routinely doing liposuction to remove the fat. So this is a minimally invasive surgical procedure in which you can get rid of the fat in just 1 day. So healing time varies from amount of the fat to be removed, but this is a very safe procedure. So I welcome you to my practice. So if you have fat in the abdomen or chest or love handles, or you want a beautiful figure in females, then liposuction is the answer. So what is liposuction? So lipo is fat, suction is we suck out the fat. So from just small holes, a cannula goes inside in the subcutaneous fat and we can remove the fat surgically and permanently. So this is the most common surgical procedure, a cosmetic surgery procedure done worldwide by the plastic surgeons, and it is very safe if we choose our patient wisely and if the clinic is accredited and the operation theaters well equipped with latest technologies. So what is difference between liposuction and tummy tuck? So if you have a lot of fat but there is no loose skin, so we do the liposuction. So if you have both, you have the loose skin in the lower abdomen and the fat, we do the tummy tuck procedure. In the tummy tuck procedure, we do the liposuction plus we do the cutting of the skin, and there is a scar in the lower abdomen and we remove the skin. So both of these procedures are very commonly done cosmetic surgery procedures, and we have to choose who is the right candidate for the liposuction and for the tummy tuck surgery. So liposuction is always done under anesthesia, whether it is local anesthesia or general anesthesia, so you don't have any pain during the procedure. So after the procedure, we prescribe the painkiller medication for around 1 week. So the pain is bearable. You can do all your routine activities at home, but there will be some discomfort in the areas for around 1 week. So once we remove the fat by the liposuction, the results are permanent. So there are very less chances that you will regain back the fat. So we do very commonly in the chest, in the arms, in the thighs and abdomen, the fat does not come back. So arms liposuction is done for the upper arm because the females, they want to wear the sleeveless suits and the dresses, and there is a lot of hanging skin and the fat in this part of the arm. So this procedure is just for 2 hours under anesthesia. So we remove the fat and you have to wear a pressure garment for around 15 to 20 days and the skin retracts back. So you are happy to go with your new pictures in just 1 month. So in the belly, so there are two types of the fat. One is the subcutaneous fat, second is the visceral fat. So visceral fat is inside the abdomen and we cannot remove the visceral fat. So if the fat which is outside, that is the pinchable fat, that is there is a soft fat we can remove, and the pot belly or the beer belly or the visceral fat cannot be removed by liposuction. So liposuction is not for the weight loss surgery. So liposuction is basically for resistant fat and the sculpting. So we can do some inch loss with the liposuction, not the weight loss. So if you are expecting your weight will lose to 10 kgs or 20 kgs, so liposuction is not for you. So if you are expecting that you will get a very good shape, like you are going to gym, so there is a certain resistant fat in the chest or in the sides of the abdomen, front of abdomen, thighs, arms, both in men and women. The resistant fat up to 3 liters can be safely removed by the liposuction. Again, to repeat, the liposuction is not for the weight reduction. For weight reduction, if you are overweight, the bariatric surgery is better. So after liposuction, if we do extensive liposuction, like all the areas and 360-degree liposuction, so we always advise our clients for the healthy lifestyle also. That means they should continue with the gymming or running activities and the healthy eating habits, because you have spent your time and money and you have come to me for the procedure. To maintain it, we always advise the healthy lifestyle habits. But the fat once removed, it is also permanent. Like, it's not very easy to regain the fat back, so it is removed from your body permanently. But to be on the safer side and to maintain the results, we always advise the healthy lifestyle habits also.